Gabrielle has been a mentor to a number of women in surgery and attempts to support trainees and colleagues. Please welcome Dr. McMullen, who will speak to you on barriers at the higher end of medicine.
I'd first of all like to acknowledge the enormous talent in this room. I'm completely overwhelmed by it. The finalists were incredible. Diane asked me to write this chapter on medicine over a year ago now, and it wasn't until about 3 weeks ago that I had access to the whole book and was able to read the whole thing in its entirety, and I highly recommend it to you all. It completely changed my perspective on the concept of merit, which I had taken for granted previously, and which is so terribly flawed. It's also made me reevaluate the issue of quotas, which I'd previously completely dismissed, and I think needs more serious consideration. What surprised me most about the book was how similar the chapters were, despite the fact that I'd never met any of the other women or even spoken to them, and how we all identified almost exactly the same barriers towards the progression of women in our professions. Sadly, sexual harassment remains a common problem. It's more prevalent in areas where men dominate, but wherever a man is in a position of power over a woman's career, it occurs. In the last decade or two, it has perhaps become more subtle and is often disguised as humour. I don't think any of us will ever forget the menu joke about our first female Australian Prime Minister: small breasts, large thighs, all presented in a big red box. But if a woman objects to a sense of humour, to a joke that she's presented with, she's dismissed as having no sense of humour and is then risks exclusion from the boys' club. Women, in fact, are completely discouraged from complaining about sexual harassment at all because, firstly, they know that they're unlikely to get any response from it at all. But secondly, they know that they're quite likely to be in a worse situation as a result of the complaint. And this, of course, occurs for women all over the world in terms of victims of rape. Victims that complain about rape often find themselves in a far worse situation, and they themselves become the objects of criticism rather than the abuser. In Australia, the ultimate step of taking legal action for sexual harassment is usually far too expensive and often unlikely to be successful. However, even when legal action is successful, it is often a failure. The result is often a failure. Despite the moral victory and a cash payout, these women are often find themselves shunned by their institutions and either without a job or completely unable to progress in their careers. And I know these women. The message is loud and clear. We are not to complain. So where is merit in this situation? Is there merit in having sex with your boss? Is it meritorious to screw your way to the top of your career? Do we still really have to tell our daughters that this is the way the world works and warn them about it? I was interested to read recently that Harvard University has completely banned sexual relationships between professors and undergraduates, and I think we should do the same in all of our educational institutions. Sexual favors should not be in the equation of merit at all. The other minefield that senior women have to negotiate is that of communication. Male surgeons traditionally behave very badly. They shout, they have tantrums, they throw instruments, they make sexist and racist comments, and this behavior is disapproved of, but it's rather fondly tolerated, and even in some quarters quite admired. But that sort of behavior is completely unacceptable from a female surgeon, and we have to tread a very fine line in our dealings with our staff. The situation is becoming more complicated in that more and more trainees in our public hospitals come from countries where women are considered inferior. These men find it very difficult to take directions, orders, or to respond to criticism from senior women. And they often respond to that with anger, and I have certainly experienced that. They can be very rude and even disobedient, and in a hospital setting, that of course is completely unacceptable and quite dangerous. The senior women get very little support from their male colleagues in this regard, and even from administration. Just last year, a senior female surgeon in New South Wales found herself in a completely toxic situation with one of these trainees, and finally made a complaint about him and showed the vile messages he'd left on her phone to her colleagues in the administration. Extraordinarily, she was the one who was made to resign from her position after being accused of bullying this man, and he suffered no consequences whatsoever. In addition, she lost her university position for no particular reason, and they did not support her at all. So ironically, the rules that were brought in to manage the bad behavior of male surgeons is now being used most successfully against women. Over the last 100 years, women have entered the workforce in increasing numbers, but we are often criticized for not working as hard as men. And I get the sense that men often feel that we don't have as much merit because we don't work as hard. Research confirms this. Women certainly spent less time in the workplace, but they of course spend a lot more time working at home. They have also made it absolutely clear that they are not going to sacrifice their children or their family relationships for their jobs. And I consider this far more meritorious behavior than the traditional male role model of sacrificing work above your family and your health. The entry of women into medicine has improved work-life balance for men enormously, and they need to be enormously grateful to us for that. The world is not a happy place at the moment. It's full of conflict and worsening inequality between rich and poor. We desperately need women at the highest levels of government and our major institutions to help solve these issues, because women do things differently, and I think we have seen that here today most dramatically. On the whole, women are more inclusive and less greedy, more conscientious and less corrupt. We need to stop the scourge of domestic violence, and we need laws that punish sexual predation and harassment, and that reward women who report these crimes, not with cash payouts, but with advancement in their careers and positive acknowledgement. We need to foster more stable and more happy families and better work-life balance, particularly if we're all going to be working into our 80s. To achieve this, we may need to consider the introduction of quotas to break the tyranny of male institutions, as despite the enormous success of women in schools and higher education, we have had little success in reaching the top levels where real change can be made. I would urge you all to read this book and to consider the evidence it presents. Thank you.